In this video, we will review how to access an implanted port. The first step is to ensure you are well prepared. Review your policy for accessing an implanted port and ask for support from your colleagues if this is a new skill for you. Make sure that your sleeves are pulled up, jewelry is off, including anything around your wrists, hair tied back, and that you remove any loose clothing or a lanyard that may get in your way. If your patient is unable to be still or is anxious, you may need another nurse or caregiver to help you with this procedure. Ensure they have put on a mask, performed hand hygiene, and, depending on where you need them to hold, are wearing sterile gloves. Identify the patient and explain the procedure. Perform hand hygiene and assess the location of the port. Note any redness or drainage. Report any concerns to the physician and do not attempt to access if there are symptoms of infection. Assess the port site for the appropriate Huber needle size. Ask the patient or caregiver if they are aware of their usual needle gauge and length. There are multiple lengths and gauges of Huber needles that can be used to access an implanted port. A 22 gauge 3/4 inch Huber needle is the most common size used. Other sizes may be needed depending on the child's weight and thickness of subcutaneous tissue. A 19 gauge needle is recommended for bone marrow infusion via the implanted port or any urgent situation that requires fluids or IV therapy to be infused very rapidly. Prior to accessing an implanted port, consider applying a topical anesthetic cream, such as Emla or Amatop, on the site. Waiting for the Emla or Amatop to be effective may not always be possible if there is an urgent need to access the port. The next step is to gather all your supplies. You will need hand sanitizer, hospital-grade disinfectant wipes, a mask, clean gloves, a dressing tray, sterile gloves, sterile transparent occlusive dressing, a Huber needle of appropriate size, a needleless connector, 2 sterile pre-filled 10 ml normal saline syringes, chlorhexidine alcohol swab sticks or chlorhexidine only swab stick if this is what your patient needs. You may also need Cavalon no sting barrier. The spray should not be used as it is not sterile, adhesive remover, waterproof tape, and a safety pin. Set up your work surface next to your patient and ensure your work surface is non-porous. Clean using hospital-grade disinfectant wipes and allow to dry for the appropriate time per manufacturer's recommendation. Don your mask. While your work surface dries, wash your hands with soap and water. Then dry with clean paper towel. Ensure to use the paper towel to turn off the tap. Prepare the supplies on your clean work surface. Open your dressing tray. Using your sterile tweezers, add the chlorhexidine alcohol swab sticks and alcohol swabs to the tray. Be sure not to put them on the sterile paper, as it will soak through and break sterility. Add your sterile occlusive dressing to your sterile field. Add your Huber needle and needleless connector to your sterile field. Add your pre-filled 10 ml sterile normal saline syringes to your sterile field. If required, add the Cavalon no-sting barrier to your dressing tray. Be sure to only use the sterile Cavalon. If your patient needs adhesive remover, add these to your clean work surface next to your sterile field. Remember, the adhesive remover is not sterile. If your patient requires blood work or will be heparin locked after the port is accessed, you can add these supplies on your clean work surface next to your sterile field at this time. Be sure not to add these to your dressing tray, as most of these items are not sterile. Remove the topical anesthetic and wipe any excess away. Perform hand hygiene. Don sterile gloves. Attach the sterile pre-filled 10 ml normal saline syringe to the cap and attach the cap to the Huber needle extension tubing. Prime the Huber needle to expel the air from the extension tubing. Clamp close to the cap and place it back on the sterile dressing tray with the syringe still attached. Place the sterile drape below the port access area. Pick up your chlorhexidine swab stick. Using a back and forth motion to create friction, clean the skin horizontally for at least 15 seconds. Then, flip the swab stick over and clean vertically up and down across your patient's skin for 15 seconds. Be sure to cover the entire skin area that will be underneath the dressing. Allow the area to air dry for 1 minute. If your patient needs to use the green swabs, then you must wait 3 minutes for it to air dry. Do not blow or wave your hand to try and speed up the dry time. Make sure your patient's skin is completely dry by looking at their skin from different angles to see that there are no wet spots left. If you put on the new dressing before the skin is completely dry, this may cause a rash. With your non-dominant hand, stabilize the port with at least 3 fingers. This will ensure it does not move when you go to insert the needle. Remove the plastic safety piece covering the port needle. With your other hand, hold the gray wings of the needle with your thumb and middle finger. Insert the Huber needle at a 90-degree angle through the skin into the septum of the port until the needle contacts the base of the port. Do not twist or rock the needle once inserted, as this may cause coring of the port septum. Unclamp the tubing and withdraw until blood return is seen. You may flush 1 ml of fluid in first if required. If blood sampling is to be done, you may proceed with blood sampling using the vacutainer or syringe method. Using your sterile pre-filled normal saline syringes and using a turbulent flush technique, flush the port with 18 ml of normal saline. Be sure to observe for any signs of swelling around the port or any pain when flushing. If the needle is not in the correct place, you will need to stop and restart with a new Huber needle. Clamp the extension tubing close to the needleless connector. You may leave the syringe attached. If your patient requires skin prep, apply the Cavalon No Sting Barrier on the skin where the new dressing will be placed. Be sure to avoid 1 to 2 centimeters around the Huber needle in the implanted port. Once applied, allow the Cavalon to dry for 30 seconds. Do not blow or wave your hand to try and speed up the dry time. Make sure your patient's skin is completely dry by looking at their skin from different angles to see that there are no wet spots left. If you put on the new dressing before the skin is completely dry, this may cause a rash. Remove the back of the sterile occlusive dressing and apply the dressing by laying it flat against the skin with the Huber needle as close to the middle as possible. Make sure you don't stretch the dressing when you put it on the patient's skin. Use the white strips to further secure the line. Use the first one to do the crisscross method around the line below the dressing to keep it secure. Use the second strip to lay flat over the line where it sticks out from under the dressing. The important thing is to make sure the dressing sticks to the skin and there are no openings. If heparin locking, proceed with heparin locking procedure now. If attaching to IV therapy, remove normal saline syringe and connect to new IV tubing now. If you need to, you can use waterproof tape and a safety pin to further secure the line. If you have any questions about port access, please make sure to ask your CRNs or CNEs and review your central line policies. You are all done.